Hindi sakita siya. Pag ginanon mo itong lamesa, dalawa lang. Dalawa lang mga dito. Tapos ito na lang dito. Ito siya. Ano lang dito natin? Sakita siya. Pag ginanon mo itong lamesa, dalawa lang. Dalawa lang. Ito.
Good morning. Let us have the report of group 1 and 2 for this morning.
Okay, Doc.
Okay, I have enabled share screen. You may start. Group 1 first. Because of the foundation day celebration, we're a bit delayed, so we will finish up to reports of group 4 before we have your first exam for this school year. So next week we will have groups 3 and 4. We would have to catch up a bit, right?
Okay, Doc.
Okay.
Doctor, can you give us 5 minutes?
Again,
Can you give 5 minutes to start the presentation?
could we add?
No, can you give us 5 minutes to start the presentation?
Okay, no problem.
Okay, Doc.
Okay, can you start?
Yes, doctor.
Okay.
Good morning, everyone. This is Mohit Kumar from Group 1. So today's our topic is Indian healthcare system. Next slide. Yeah, here is the content of our whole report. So first of all, we're gonna just introduce you with the Indian healthcare system. Then we will give some definitions. Then we will go further for the public sectors in the healthcare, means the different role and the different problems we had faced during the COVID-19, because this is also the part of the healthcare system. Then we will go for the conclusion. Next one, please. So first of all, for the introduction, if you are going to discuss about any kind of the system, that's sure that the small part of the system that will together come and make a bigger system. So the Indian health system is also made up like this only, like that is for to provide the good health to the people of the India, and prevention and the treatment and the management of the illness. Like we can take the example of the COVID-19. At the time of the COVID-19, different departments of the healthcare system, they were working on the different things, like the department of the healthcare system, which are for the making of the equipments. They were working the different kind of the PPE kits, and departments who are making the vaccinations and all. So that all divided. So here is the, according to the WHO, healthcare embraces all the good and service designed to promote health, including the preventive, curative, and the palliative interventions, whether direct or indirect, directed to the individuals or the population. Next one, please. Here is the definition of the health. So for the if we are saying someone is healthy, then we have to make sure that the person is physically, mentally, and socially well-being. It's not just if someone is not having the disease diagnosed, so that person is healthy. So we have to make sure that the all three things are proper. So here is the Indian health sector. So the Indian health sectors consist of the medical care providers like the physician, specialist clinics, nursing homes, and hospitals, diagnostic service centers like pathology laboratories, medical equipments manufacturers, and contract research organizations, CROs, and the pharmaceutical manufacturing companies. Third party support service provided like catering and the laundry as well. So if we will go in the historical perspective of the Indian healthcare system, then there are the two perspectives, like first one before the Indian independence and after the Indian independence. So before the Indian independence, we were using the traditional practitioners of the healthcare have contributed to the medicinal needs of the society. And they made some patterns which were dominance of the British changed the scenario. Hospital managed by the Christian missionaries took center stage. Even the intellectual elite in India, with their pro-West bias, favored Western patterns till now. So after independence, the healthcare system of India boosted up a lot. After independence, the government of India laid stress on the primary healthcare, and India has put in sustained efforts to better the healthcare system across the country. The government initiative was not enough to meet the demands from the growing population, be it in primary, secondary, and the tertiary healthcare system. Next one, please. So here is the entry of the private sector. As we have discussed, like the government was not able to provide the to manage the all type of the systems which are making the proper Indian healthcare system. So here in 1980s, private sectors of healthcare system entered, and they were also providing the good supply and the demands of the healthcare. The private hospitals are managed by the corporate, non-profit, or the charitable organization. The establishment of the private sector has resulted in emergency of the opportunities in terms of the medical equipments, information technology in health services, and telemedicine and medical tourism. Next one. So here is the traditional healthcare system in India. As we know, India is the very old, means the before so many years they have started their proper traditional healthcare system. So first one is the Ayurveda, then Siddha, and then next. So the Ayurveda is, the meaning is of Ayurveda is like science of life. System deals with cause, symptoms, diagnosis, and the treatment based on the all aspect of the well-being, means the mental, physical, and the spiritual health as well. Now, Siddha system defined disease as a condition in which the normal equilibrium of the five elements of the human beings is lost, resulting in different form of discomfort. Next one. Yoga is nowadays very much popular between the all around the world. So a Hindu spiritual ascetic discipline, a part of which including breath controls, simple meditations, and adoptions of specific bodily postures is widely practiced for health and relaxation. Naturopathy believes that all the disease arises due to the accumulation of the morbid matter in the body, and if scope is given for its removal, it can be cured. Now, the next system is the Unani. Unani system of medicine believes that the body is made up of the four basic elements like earth, air, water, and fire, which have different temperaments, like for that cold, hot, wet, and dry. Next one, please. So the role of public sectors in health. The public healthcare system consists of the facilities run by the central and the state governments. As we know that the Indian healthcare system is also divided into the two parts. First one is the central government, and second one is the run by the state government. These public facilities provide free or the subsidized rates to lower the income families in rural and the urban areas. The Constitution of India divided health related responsibilities between the central and the state governments. Next one. So here is a flow chart, like the Indian healthcare total infrastructure. That's something like this, like the on the higher level, that's the national level Ministry of the Health and the Family Welfare. Now, second one is the state Department of the Health Family Welfare, then Apex Hospital, then district hospitals, and then divided in the rural area and the urban area. In urban area, we have the hospitals and the dispensaries, which are on the bigger level. And in rural area, we also having community health care system and primary health care subcenters. The Ministry of the Health and the Family Welfare comprises the following departments, each of the which headed by a secretary to the government of India: Department of the Health and the Family Welfare, Department of Ayush, Department of Health Research, Department of the AIDS Control as well. So the next one would be continued by one of other my.
For those who are not familiar, I'm sure most of you are. What does Ayush mean? What does Ayush mean? It stands for
Ma'am, it stands for Ayurveda, Yoga, and Naturopathy, Unani, Siddha, and Homeopathy.
Ma'am, it stands for long life.
yes. So your Department of Ayush would focus on these five health interventions, mainly what was discussed. You discussed Ayurveda, you discussed yoga, Unani, Siddha, and homeopathy. Okay, go ahead, continue.
Hello, myself Manan. I'll be continuing the presentation. The healthcare infrastructure in rural areas. The healthcare infrastructure in rural area has been developed as three types. As my friend showed already you the structure, how the infrastructure is in India. It is divided to sub-centers, primary health centers, and community health centers. Next slide. So we'll go with the sub-centers first. In rural areas, health sub-centers form the institutional basis of primary healthcare. It typically performs basic medical services, immunizations, and referrals. Sub-centers are usually temporary structures that employ one or two care workers in most locations. Next slide. Now the functions of sub-centers: maternal and child health, family planning, immunization, nutritional services, control over communicable disease, records of vital statistics. Now we'll go with the primary healthcare. Primary healthcare centers typically perform preventive and curative medical services. These are usually small, about 5 beds with 1 2 qualified doctors and 14 paramedics and support staff. Each primary health center is typically a referral unit for a subcenter cluster of about 6. The primary, can you go back? The primary healthcare centers are in charge of 6 subcenter each. Now the functions of subcenters: the primary health centers: medical care, medical health care and family planning, safe water supply and basic sanitation, prevention and control of diseases, collection and reporting of vital statistics, education about health, national health program involvement, training of health workers. Now we'll go with the community health center. The secondary sector of the Indian healthcare system consists of rural hospitals and community health centers, serving 4 primary health centers, and the CHS specialized medical services are intended for 100,000 people. Now the functions: care of routine and emergency 24-hour delivery services, essential and emergency obstetric care, full range of family planning services, safe abortion services, newborn care, routine and emergency care of sick children, foreign body removal, tracheostomy, etc. Implementation of national health programs. Healthcare situation as an area of concern. Only 43.5% children are fully immunized. Only 79.1, like almost 80% of children from 6 months to 5 years of age are anemic. 56.1% ever married women age 15 to 49 are anemic. Infant mortality rate is 58 by 1000 live births for the country, with a low of 12 for Kerala and high for 79 for Madhya Pradesh. Maternal mortality rate is 301 for the country, with a low of 110 for Kerala and high of 517 for UP and Uttaranchal in the 2001 to 2003 period. Two-thirds of the population lack access to essential drugs. 80% of healthcare expenditure borne by patients and the family as out-of-pocket payment. Health inequalities across states, between urban and rural areas, and across the economic and gender divides have become worse. Now we'll come to the key challenges. Despite these gains, a high proportion of population continues to suffer and die from easily preventable disease, lack of access to affordable and quality care, and malnutrition. Women and children from low-income households are most vulnerable. Problem areas include maternal and child health. Only about half of pregnant women receive adequate antenatal coverage. At least 3 visits during one pregnancy. This percentage remains low and stagnant, while the percentage of children between 12 to 23 months of age that are fully immunized rose from 46% in 2004 to 54% in 2008. These levels remain unacceptably low. We'll continue with the key challenges. Childhood nutrition. Despite the largest child nutrition program in the world, the rates of childhood malnutrition have remained unchanged for nearly 2 decades. 48% of the children under the weight of 5 are stunned. It means low height for like average low height for that age group. 43% of underweight, having low weight for that age, and 20% are wasted, like low height and small weight. New diseases on the rise. At the same time, new health challenges are emerging. The rise in chronic adult diseases and injuries is stretching the system's capacity to respond. Non-communicable diseases and injuries already account for about 60% of India's disease burden, led by cardiovascular disease, mental health injuries, cancer, and diabetes. Current public health program, novel coronavirus disease. I think you all must be familiar with the coronavirus. Next slide. These are the 10 essential steps of public health services. Next slide. The government of India's combative measure against COVID-19. As you all know, we have all gone through this lockdown phase. So the lockdown is the most preventive and creditable measure to stop the spread of novel coronavirus by government of India. The pandemic affected areas were divided into three zones, namely green zone, orange zone, and red zones, where the red zone falls under the category of most affected and therefore has strict regulations. The government of India has identified approximately 319 districts in the green zone, 284 districts in the orange zone, and 130 districts in the red zone. Now, the second part was economic packages. The COVID-19 as a major global health crisis had left indelible imprints on the various sectors, including the economy. Therefore, for boosting the economy and industrial sectors, strengthening the country's health infrastructure, and for the treatment of COVID-19 infected people, the government of India has provided a financial package of 15,000 crores. The government of India has declared the economic package worth to 20 crores under the scheme of Atmanirbhar Bharat, Self-Reliant India, as a post-pandemic economic plan aimed at helping the economy to recover from the devastation caused by COVID-19. Now we'll come to the National Task Force for COVID-19. The Indian Council of Medical Research has constituted a national task force for COVID-19 to effectively and systematically contribute to the ongoing pandemic scientific and technical responsibilities. The main objective of National Task Force are to immediately initiate the research studies and identify research priorities for clinical research, diagnostics and biomarkers, epidemiology and surveillance, and vaccine and drugs development. Now the protective kits. Personal protective equipment, PPEs, is a protective device designed to protect the workers, designed by reducing exposure to biological agents. The PPE kits include goggles, face shield, gloves, masks, gowns, coverall, shoe cover, head covers, and the frontline workers, that are doctors and healthcare workers who have been engaged in the services of COVID-19 patients. Currently, India has become the world's second largest PPE kit manufacturer. This initiative results from joint effort made by the various government institutions like the Defense Research Development Organization and the Ministry of Textile, along some private manufacturers. Now we'll come to medicines and vaccines. India is the world's leading manufacturer for vaccines and generic drugs. Several research institutes in India have been working on separate programs to find a coronavirus vaccine. The Indian Central Drugs Control Standard Control Organization has approved the use of Glenmark pharmaceutical generic for the treatment of COVID-19 patients for the respective generics of Favipiravir and Cipla and hetero drugs for remdesivir. A vaccine called Covaxin was developed by Hyderabad-based Bharat Biotech in association with ICMR. Now we come down to the conclusion. India's National Rural Health Mission is undeniably an intervention that has put public health care upfront. Although the government has been making efforts to increase health sector spending via initiatives like the National Rural Health Mission, but still there is much to be done. The priority will be develop effectively and sustainably health systems that can meet the dual demand posed by the growth in non-communicable disease and people need for better quality and higher levels of healthcare. That's all from my side. Thank you.
Okay, thank you. Please forward your PowerPoint and peer evaluation for each for your group according to your participation for this group reporting. Okay, so your Indian health system, it will, as we have learned, health systems would be critical, especially in providing help, especially in critical situations such as the pandemic. Okay. So you will see if your health system is not healthy or not functioning well, it would not have responded to a crisis such as the pandemic. Okay? For example, your pandemic, you had your Delta virus and it your health system was somewhat overwhelmed, but somehow it was able to cope up. Okay, and that is the importance of having a health system that is adaptable and reflexive, flexible to withstand certain changes. Okay? Okay, let's have group 2.
Okay, doc. Good morning, everyone. Sandeep. From Group 2, we are representing the topic public health system. What exactly is public health system? A system in which it helps to promote public health and prevent diseases. There are several definitions defined for public health system, and some of them are it's defined as the sum of all official or government efforts to promote, protect, and preserve the people's health. It's kind of like all official means the organizations which are involved in public health systems. It might be government sector or private sector, which collab each other and efforts to promote, protect, and preserve people's health. The science and art of preserving disease, prolonging life, and promoting healthy and efficiency through organized community effort. The process of mobilizing and engaging local, state, national, and international resources to ensure the conditions in which people can be healthy. The science and practice of protecting and improving the health of the community as by preventive medicine, health education, control of communicable diseases, application of sanitary measures, and monitoring of environmental hazards. For example, in the context of COVID-19, there are several organizations in local or state or national or international. They have been using all the resources such as army to to work in the quarantines. They used to follow the strict rules, organizing a better to organize a better public health. Public health is what we see, what we society do collectively to assure in conditions in which people can be healthy. Public health is a science and art of saving the lives of millions at once by decision or intervention. Framework Public Health Administration. The important elements of public health administration are performance standards, performance measurement, reporting progress, and quality improvement. Performance standards. Standards may be set based on national, state, or scientific organizations by benchmarks against similar organizations or by other methods. Identify relevant standards, select indicators, set goals and targets, communicate expectations, performance measurement. It is Important to set criteria and establish scope, refine indicators and define measurement, develop data systems and collect data. In performance standards, basically, organizations set some benchmarks like it might be a state or a national. For example, a place might be having more number of positive cases, another place might have very low positive cases. It has a set of goals and targets to bring down all the positive cases, and it have some set and goals of targets like we are like increase of vaccination towards all the people. And developing data systems, in the past, we used to have a one system and we used to get all the data through a newspaper or the some other way. But now, just a simple click in an app in our phone, we can know all the statistics of any disease all around the globe. Reporting progress. It is how public health agency tracks and reports progress depending upon the purpose of it. A robust reporting system makes a comparisons to national, state, or local standards or benchmarks to show where gaps may exist within the system. Analyze and interpret data, reports results broadly, develop a regular reporting cycle. In reporting progress, the health agency tracks in the context of COVID-19. Our health agencies used to track the number of positive cases, their past history travel, and they used to maintain the quarantine for those who are affected by COVID-19. A robust reporting system makes comparison to national, state, or local standards. We used to compare, in India, we used to compare a state to state positive cases. So, in a state, they might be following strict rules implied by the government association. In some other state, they used to not follow some strict rules. So, these benchmarks are used to provide the gaps which allowed the government officials to take care of those all, so that all the people in that area used to follow the rules. Analyze and interpret data, reports results broadly, develop a regular reporting cycle. Quality improvement. It is the establishment of a program or progress to manage, change, and achieve quality improvement. In public health, policies, programs, or infrastructure based on performance, standards, and measures. Use data for decisions to improve policies, programs, and outcomes. Create a learning organization. Quality improvement, it's like establishing a programs to enhance our public health like implementing health policies, etc. Health organization and health services. Public health is defined as the science of protecting the safety and improving the health of communities through education, policy making, and research for disease and injury prevention. The field of public health administration concerns itself with the administration, leadership, and management of health care systems, such as hospitals, networks, and public health systems. Three principal areas: studying in the theory, the concept, and skills of management. Studying the healthcare industry itself. These include areas such as health and human behavior, epidemiology, and medical care organizations. Some of the most important challenges of strengthening the public health systems are in governance and management. On a day-to-day basis, administration is needed to ensure that organizations operate efficiently and with success. Some of the most important challenges of strengthening the public health system are in governance and management. When there is a strong governance and a management, there would be a good public health system. Focused on disease prevention, health promotion of community people via various programs like drinking healthy water, occupational environmental health, as well as ongoing surveillance of health related issues in the community. Finally, it is an organized attempt to improve the health communities. They also implement programs such as knowing the importance of maintaining healthy surroundings so that people can live with good health. Public health law. According to Boston, public health laws are such legal forces and duties of organized society by which conditions for maintaining citizens' health are ensured. Public health law refers to a or rule or local ordinance that has the purpose of promoting or protecting the public health. Effectiveness of public health laws. To make the health laws effective, the following factors are important: useful health system for proper solving, proper economic policies, community participations, constitutional support, periodic review of the health laws, strong political will to implement health laws, proper resources. Importance of public health laws at world level. The chief objective of international laws is to improve health status at international level, to eradicate health risks for global environment or to minimize them, to prevent health risks which may happen due to international travel, to assist international agencies and institutions in health management and regulations, to increase awareness and interest regarding health in the entire world. The public health workforce and financing. Public health workforce. Public health workers are defined as all those responsible for providing the essential services of public health regardless of the organization in which they work. It might be a physicians or health managers, occupational health or safety personnel, or someone who are health promotion specialists and community development. It might be anyone that comes under public health workforce. All those providing essential public health services, regardless of the nature of the employing agency. The public health workforce includes those primarily involved in protecting and promoting the health of whole or specific populations. The public health workforce is characterized by its diversity and its complexity and includes people from a wide range of occupational backgrounds. As I told, it might be physicians or nurses or health managers who are trying to promote public health workforce. What is public health system? A health system is the sum total of all the organizations, institutions, and resources whose primary purpose is to improve health. A health system needs staff, funds, information supplies, transport, communication, and overall guidance and direction. A health system needs to provide services that are responsive and financially fair while treating people decently. Public health finance. A good health financing system consists of raises adequate funds for health, ensure access to quality health care regardless of ability to pay, protects people from financial catastrophe, allocates resources, and purchase good services in ways that improve quality and equity and efficiency. We have seen in COVID-19, many countries have gone through financial catastrophe. It's like allocating some resources to health department. We have seen some countries used to neglect health departments and they used to allocate their all resources towards the other sectors, which has been a major disappointment for the public health. Health financing is one of the main functions of the health system. It is defined as the raising or collection of revenue to pay the operations of the health system. It is a key determinant of health system's performance in terms of equity, efficiency, and quality. Principal functions are revenue collection from various resources, pooling of funds and spreading of risk across larger population groups, and allocations are used or funds to purchase services from public and private providers of healthcare. Financing is a function of health system concerned with the mobilization, accumulation, and allocation of money to cover health needs of the people individually and collectively. The purpose of health financing is to make funding available as well as to set the right financial incentives to providers to ensure that all individuals have access to effective public health and personal health care. In India, in some states, there are shortage of beds in government hospitals. So they have collaborated with private hospitals and providing staff to the private organizations. They have run successfully in treating COVID-19 patients. This comes under a term point of finance. What are the sources of health financing in India? There are four in which public or government source, second is private sector, and third is external source, and fourth one is mixed one, which consists of missionaries, institutions, and charitable trusts, and health insurance, etc. Under public or government sector, there is Ministry of Health, other public government departments and undertakings, local and municipal and regional government authorities, compulsory government health insurance schemes, government lotteries, other. In private sectors, it includes private individual household expenditure, private employee healthcare fund, private corporate or health insurance. Health policies and schemes given by government. There are health policies which are redefined every year, and some of them are national health policy, which is established in 1983, And this follows on for National AIDS Control and Prevention Policy in 1992, which is for HIV patients, and National Nutrition Policy in 1993, National Policy on Older Persons in 1999, National Policy Population Policy in 2000, National Policy for Empowerment of Women in 2001, National Blood Policy in 2002, National Policy in Immune Systems of Medicine and Homeopathy in 2002, National Health Policy in 2002, National Policy for Access to Plasma-Derived Medical Products from Human Plasma in 2003. Health policies, again in the National Chapter for Children in 2003, National Rural Health Missions in 2005, National Environment Policy in 2006, Right of Children to Free and Compulsory Education Bill, which implies for education of children aged between 6 to 14 years in 2009, National Pharmaceutical Pricing Policy, National Water Policy in 2012, National Policy for Children in 2013, National Youth Policy in 2015, and National Health Policy in 2007. And some of the important schemes which have been implemented in government are Ayushman Bharat Yojana, Pradhan Mantri Suraksha Bima Yojana, Aam Aadmi Bima Yojana, Central Government Health Scheme, Employment State Insurance Scheme, Janashri Bima Yojana, Chief Minister's Comprehensive Insurance Scheme. These schemes are actually helpful for the patients or the people in India. Like it might be any income. The income if someone is having these schemes, they might their family or the patient might get money from the government, and which is helpful for treatment of their concerned problems. And now I request my other groupmate, Fatin, to take over the presentation.
Okay, problems India face in public health administration. One drawback is the neglect of providing health services among the rural population. Deficiency of human resources in health occurs at several areas, between regions, between rural and urban areas, as well as between the public and private sectors. On one hand, there is heavily based hospitals in the urbans. There is a preponderance of the health manpower in the dominant for-profit private health sectors in the country, thereby putting their services beyond the reach of the majority of poor in the country. On the other hand, here is unwillingness of doctors and other health personnel to serve in rural areas. Why is this so? Because rural areas are underdeveloped and deficient in both personal or family amenities as well as clinical support. Hence, in this setting, it does not attract doctors or other health professionals under the current circumstances. This just brings forth that healthcare services is visibly biased. Next slide. In social inequality, the growth of health facilities is imbalanced, seeing that the rural areas are very underserved. The shortage of medical personnel, especially in the rural areas, is a majority concern in India. A large number of trained doctors have left India for residency training and to work abroad, while the remaining works in the urban areas. This will moreover bring insufficient doctors to provide care in comparison to India's vast population. Next. Lastly is the expensive health services. Various essential drug prices have gone up. The various schemes, which are the alternative system of medicine, should be emphasized more as they are less costly and therefore will serve the community better. This concludes that healthcare system can be improved through efficient planning and better allocation of funding provided. Next. What improvements can be brought upon the public health administration in India? Firstly, resource allocation and priority setting. By regulating drug distribution of free medicine, as well as even high-priced prescriptional drugs should be controlled to remain affordable. Secondly, healthcare prices should be regulated to serve the public. This heavy price is a burden among the poor community, as well as the government should also see that healthcare allocation of funds should be seen as spending for the betterment of their citizens rather than seeing it as an investment. This will not only bring about development, but also growth benefit for the country. Next. So what other improvements can be made? Thirdly, improve access and infrastructures in rural areas, because most hospitals in India don't even have access to water supply, electricity, and even some medications such as a simple painkiller. Emergency units are there, but unable to accommodate or handle any emergency due to poorly equipped. Not just that, the healthcare manpower is so skewed where it favors the urban community rather than the rural areas, have less accessible to qualified doctors. Fourthly, more public cancer treatment centers should be built because India reported an increase in cancer in both rural as well as urban areas. Unfortunately, despite severe cancer being treatable, many are unable to afford comprehensive treatment and many families go bankrupt. Hence, the government needs to set up more centers in different cities to provide ease of treatment. Lastly, regulate allocation and priority settings. By regulating drug distribution of free medicine, even high-priced prescriptional drugs should be controlled to remain affordable. The last point, number 6, healthcare prices should be regulated to serve the public. This heavy price lastly is the launch of concrete PPPs. In a country over 1 billion, it is impossible for a government to provide healthcare for all. So private sectors play a leading role in meeting healthcare requirements of the country. The goal of public healthcare can therefore be achieved faster and more comprehensive if public and private sector launch long-term partnership with a vision to reach its last citizen. We expect government to make concrete announcement on the 3 Ps to help improve access and affordability. Thank you.
Okay, you're telling medicines, but as you have experience, if you compare the Philippines and India, your medicines are a lot more cheaper there than here, than healthcare in the Philippines. But still, again, you could not want you would always demand lower cost of healthcare from your government regardless from where you're at. Okay? Some could provide it for free, maybe for some special populations. But of course, with a vast population such as yours, it is not feasible to provide health care for all that is free in India. We will learn about those concepts later when we do resource allocation and problem prioritization when we do community organizing at the end of the year. Okay, so you see how important a public health system is. So we looked at it closely, Indian health system, and then in general, a public health system and how a government should run its healthcare system. Okay, and it's not always, and it will depend on your per capita. Of course, with a big population, more would have to get a share of the pie. If that is the assessment, then the health system of India would never rank above. Okay, usually, if you will see in the PowerPoint the last time that we discussed, or you will see, the ones that would be considered better healthcare systems would be small populations with a high GDP. The largest country which was considered with a good health system was France. But again, France is also not a big country and not as populous as, for example, United States, India, or China. All right? Any questions? So you see the importance. And again, we look at the same problems. Okay? Your public health system would look at theory, concepts, and skills. And actually, it's managing like a company or an organization. But of course, it is not for profit, but for health. One problem, rural. Facilities, logistics, even here in the Philippines, there's there's a particular program to incentivize doctors who go to the barrios or doctors who go to the provinces, particularly because of the reasons that you have stated also in your presentation. It is far from their own family unless they come from that place altogether. Lack of facilities, lack of continued growth in their career, etc., etc. All right. Are there any questions for this afternoon? Okay, so per group, you submit a peer evaluation and your PowerPoint presentation. I would get questions from each one's report in the exam and also in the lectures that I will provide. Okay, I will send a link to supplement your readings on public health system. Also, okay. So for
Okay,
next meeting, we will have groups 3 and 4. So make sure you go back to the reports of your classmates. If you fail to attend this class, you could go back. It's on YouTube. You could play back. Okay.
Good afternoon.
We'll have 3 and 4 next meeting, and then we will have our first examination after that. All right.
Okay, doctor.
See you next week. 3 and
Thank you,
4.
doctor.
Get ready. Thank you. Thank you.